All right, we are back with another 40 Under 40 Public Health Catalyst Award winner, cohort 2. I'm Dr. Candace Carpenter. I'm one of the co-CEOs of BCPH. And I wanted to remind everybody that 40 Under 40 is a very special award that the Boston Congress of Public Health created a few years ago to be able to award the next generation of leaders, researchers, academicians, entrepreneurs, directors, and much more within public health as well as social justice. So we have Dr. Victor Ekuta with us. Victor, I'm not going to steal your thunder. I will allow you to introduce yourself to the audience.
Okay, thank you so much, Dr. Carpenter. It's really a pleasure to be here. And thank you for your time. Everyone, Dr. Victor Ekuta here. Just a little bit about me. Currently, I'm doing research as a postdoc research fellow at the University of Pennsylvania. And I'm really passionate about brain health and health equity and trying to make sure that everyone can have a healthy brain, has access to that. So really excited to be here. Thank you so much.
Awesome. Thank you. And so Victor, you have a lot of different hats that you wear, right? Similar to many people that we've interviewed on this before, being a physician, being interested in public health, and then doing some other things. Can you walk us through like what got you interested in like these different parts? Did they all intersect from the beginning, or like how did you come to be, I guess?
Sure. Great question. I think my interest kind of began first with neuroscience. I was really kind of fascinated by the brain and how you have this, 3-pound organ that controls so much of who we. And so in college, ended up doing a major. It's called PNP, stands for Field of Neuroscience Psychology, and that was kind of not a great opportunity to study the brain and neuroscience, but to understand the importance of diverse perspectives to understanding big problems like the mind and brain. And so I kind of pursued that, trying to figure out that I want to approach it from the research side or from the medicine side. And because I liked kind of working with people, I thought going to medical school would be sort of the best path. While I was in sort of medical school, that's kind of when I got turned on to sort of health and health disparities, starting with being in clinic. We see certain patients aren't treated the same way, and they don't, they have other things outside of just their general health that affects their ability to be healthy, like where they live and what they're able to eat. And I think things really sort of came kind of collide together during the time of COVID, when all these kind of, health disparities and things were in our face. And at that time, I had actually taking some time away from medical school. I was doing research, and I got kind of involved in some hackathons. I'd always wanted to do one, but I don't know how to program. And so it was like MIT had a couple of these hackathons to try to address issues with COVID. And I thought it was really exciting. You're working with people, virtual, I had people on my team all the way from like India, from like, I don't know, from like parts of Latin America, like Brazil. It was just exciting to work with these people with different backgrounds to try to solve a problem. And so I knew I liked kind of the innovation side. And then finally, as a result of that interest, started to get learn a little bit about kind of pulse oximeters and some of the disparities there. So I think that kind of where I started to get this like health focus that's tied in neuroscience and to try to, be an agent to create more brain health equity.
Yeah, absolutely. It's kind of an interesting journey, kind of as you said, like with MIT, and then like things happening during COVID, which I think, the pandemic and everything resulting around that, the Black Lives Matter movement kind of rearing again during that time, really, I think, impacted people's trajectory. I know, you've been a thought fellow with BCPH as well, and I know you've written some really eloquent pieces and insightful pieces on pulse oximeters and other types of technologies that don't really take Black people's skin color into account in terms of being able to interpret things that are very important to be able to understand like our health or like our medical condition. Can you speak more about that? Pulse oximeters or anything that you'd like? Because I don't think many people are that aware. I think people think that a lot of these technologies are basically one size fits all.
Yeah, definitely. And I myself also thought that before doing some work with the pulse oximeter. So what had happened is that during the time of COVID, there had been a paper in the New England Journal of Medicine, as well as there's a I don't know, this guy maybe it could be less accurate in people with darker skin. I remember reading this and kind of being shocked because pulse oximeters are so widely used in medicine. Like for every time we, even as medical students, we see a patient, we go measure, their O2 sat. So to me, the idea that this device that people rely on could be potentially inaccurate was something that was I started reading more and more. A time I was doing this sort of innovation program with IT, working teams, and we're trying to find different problems. And so it was just once I heard about this and read, like, oh, this is like the perfect thing. Like, this is MIT. They're good with technology. This seems to be a very clear, at least to me at the time, health equity issue. This is great. We're going to make a new pulse oximeter. I quickly learned it wasn't that easy, but I did through the process of having to interview people, like interview different physicians. I found like a lot of people didn't even know about this potential issue. I met with the CEO of Massimo, one of the big pulse oximeter companies, and kind of got their perspective. But just learning that, like, one, this was an issue a lot of people didn't know about, but two, I was surprised it prospers as early as the 70s. One even said that even in the 40s, this had been described that these devices could work less equitably. And so, yeah, to me, that was just kind of like opening and shocking, especially because even the regulations around pulse oximeters didn't seem to be done in an equitable way. So, the FDA, for example, one of approving these devices just required that the study have, I think, at least two darkly pigmented individuals or 15% of the subject pool, whichever one was higher. And if you think about that, I mean, that doesn't sound like enough to me. And potentially maybe that is something that could have been masking the problem to some extent. And so that got me turned on to this idea of, trying to make better technologies, make them work better for everyone. Because when people use these technologies, they rely on them sometimes as like the absolute truth. Like to get someone's oxygen, you put on this device, that's what it is. The alternatives are to look at the person's skin color. But you can imagine someone who's darker skin, you're not gonna notice a change in oxygen until they're even more sort of desaturated. So you kind of see these things. I even see it in my work now with brain stimulation, transcranial magnetic stimulation. We have to, or transcranial direct current stimulation. We have to place certain electrodes in people's hair, and people darker skin sometimes have certain hairstyles that may not be as conducive to this technology. But if we're not careful in how we think about these technologies or making them work for everyone, then we end up doing research that excludes certain groups and only continues to amplify these kind of disparities. So I would say that's how I got interested, and why I'm still interested, and why I think this is an important issue.
Yeah, absolutely. I know, and I continue to be shocked as well, with the disparity that, the TMS and the pulse oximeters can have. Because yeah, as you said, right, people take this as the absolute truth, and it's not. And so then when we wonder like why health disparities are happening for Black Americans or say Latinx, et cetera, is there a structural racism piece of the technologies that we're utilizing to even try to help them in the first place? Like it may not just be that one. And that's the thing that's even scarier. Like how many levels have been compounded to really add to those disparities. But that leads me to a great quote that like is instilled in my brain that you wrote a couple months ago in terms of racism kills with 1,000 cuts. And you were talking about Alzheimer's. And so something I don't know if all of the general public is aware of, but I'd love you to just expound upon the research that you did with Black men having Alzheimer's and then its intersection with racism.
Sure. So I've been fortunate to participate in this Black men's brain health program. The program started a kind of collaboration on the Alzheimer's Association as well as the NFL Alumni Association to try to develop researchers to do more brain aging research in Black men, as well as they also wanted to build a Black men's brain health sort of research registry. And this was a really great opportunity for me. One, to kind of uh, build up my research skills. So as part of the process, I had to come up with a project. I ended up developing kind of like a research proposal to, well, there were kind of two parts to it. So first, I went into the program kind of interested in like biomarkers. I'd done a little bit of work looking at biomarkers in Alzheimer's disease, and so I was curious, like, these biomarkers look the same way in all, in different groups. Like, are the biomarkers are they the same in African Americans versus not? And so was trying to find like a data source to use, but was having some trouble. So eventually I got connected with a different mentor in the program, Dr. Robert Turner. He actually had a short stint in the NFL, but he was working with a group at Boston University that studies chronic traumatic encephalopathy. So basically, they're trying to come up with the diagnostic criteria for that. They're also looking at how does repetitive head impacts affect later life outcomes. And so as I started working with their group, I kind of had a similar question, which is, okay, we know that these repetitive head impacts could eventually cause later effects on like brain structure and function. Do we know, however, if the effects we see could be different in different races, due to race, but due to other things we know that are associated with that? And looking in the literature, you don't see too many people are actually looking at that. So that's kind of got me started a project I'm doing now, which is to see how, like, does the age at which one first starts playing football, does it affect the kind of long-term neurological outcomes you see? And then two, is that relationship different for different races? Now that this can have kind of policy implications as to whether people should be starting football at a later age, because it's you see the really bad effects if it's younger. And then two, if it's different for different groups, what does that mean about kind of the role of football and maybe how we should approach I don't know, trying to limit some of these adverse neurological outcomes. The second piece I had mentioned, I went to this program interested in like biomarkers and differences. So the proposal that I actually worked on in this program, I continue with, I actually end up using that to start another project, which I'm doing now, to look at race-related differences in Alzheimer's disease biomarkers. So this has been like a really rewarding, kind of rich program for me. Allowed me to work with many different mentors to be able to get better at thinking of science and coming up with a project, and trying to do something that will hopefully improve the brain health for Black men.
Awesome. So it sounds like, yeah, as you said, beyond rewarding, it's like very allowed you to be or to become like more prolific, and a lot of that research to just spin off of itself. That sounds really awesome. If we can kind of switch gears back to public health, so I know like you're interested in brain health, neurological health, cognition, but are there other areas, I guess, in public health or social justice that you're incredibly passionate about?
Yeah, on the social justice side, although I haven't myself done much research with it, I feel I'm pretty interested on the legal side. I mean, talk at length as some of the disparities you see when it comes to the social justice system, especially among Black men. They can be arrested at higher rates, when arrested, charged at higher rates, then convicted at higher, and this has like significant effects for not only Black men but the rest of the Black community. So part of my interest in that has been related specifically to mentorship. So back during undergrad, I did a mentorship program specifically with Black males, St. Paul Saturdays, and each sort of Saturday we'd have the men come, sort of help them with their homework, and also have them repeat this phrase. I'll see if I can remember the slogan. Um, Basically, to have young African American men with a sense of healthy and these kind of principles, and so that hopefully they aren't going to become kind of another statistic of our justice system. So I'm pretty passionate about that, like the mentorship piece, um, trying to, I don't know, do what I can to reduce some of these social justice issues we see, particularly with the legal system. I would say that that's another big area of interest.
Yeah, absolutely. And one that I also share as well, Victor. And it's interesting for those of us who are physicians having that interest in an area that say we may not be experts in the criminal justice system, in the harmful effects of policing in the Black community as well. I wanted to say, if you had a magic wand and there was anything that you could change about public health in the US or even around the world, because I know you may have some interest in other things in other countries, what changes would you want to see?
Yeah, that's a great question. It's a big question. I'm trying to think of like where to start. Um, I think one big piece would just be care access in general. It, like the way things are set up now, it's sometimes difficult for people to access the healthcare resources that they need. You have people from lower income communities care site. If we could develop a better model that could give people access, because just starting there, if I don't know, I feel like if we can address that issue, you can help to some of the later effects that has on families and on communities. I would say that that would be a big piece. What else in terms of public health? I already mentioned a little bit about like the legal system. I do think that that is a public health issue, and we saw some of that with the white coats for Black Lives. But really having, I don't know, I think having physicians better to try, like, yes, first and foremost, our responsibilities to deal with the medical needs of the patients, but better equipped to deal with some of these social issues as well simultaneously. I think that that's something that could um, help society a lot.
Mhm.
Um, what else? I think I would start with those two. I mean, there's a lot of things that one could address, but I would say start there.
Yeah, absolutely. And then finally, for those in the audience who haven't quite started their journey yet, but might have just an inkling for public health or social justice, what advice would you give them on their journey, whether or not they're thinking about doing public health on its own, with medicine, or otherwise?
Yeah, great question. I think my biggest advice would be to, I don't know, if there's something in public health you're passionate about, to not let anyone get passionate away, to stay passionate about it, to keep sort of fighting the good fight for whatever it is that you believe in, because we need all we can get in public health, and not everyone believes it's important. Um, until we have we had like a crisis like COVID, and suddenly people are like interested, but we've had some of these public health issues for a while. And rather than waiting until we're in the midst of chaos, it'd be great to try to address some of those now. So if there's someone who's passionate about public health, definitely keep pursuing that passion, learn as much as you can. Um, and you have an important voice to contribute, even if you don't have a formal background in public health. Just having an interest and a willingness to learn and to grow and keep pushing, I think, is important. So that would be my words of advice.
Yeah, I just want to echo those sentiments that you had, fighting the good fight, but then also having that openness and willingness. And I completely agree. I know I'd interviewed another 40 under 40 who does not have a formal public health background, but has definitely been steeped in public health and all the traditional ways and some unconventional ways as well, that we can think of in terms of public health. Well, Victor, is there anything else that you'd like to say the audience before we part?
Just thank you so much for the opportunity. Great to see you again, Dr. Carpenter. It's been great to be involved in public health. And yeah, hopefully someone found this.
Awesome. Awesome. Well, thank you so much, Dr. Ekuta. So if anyone is interested in learning more about Dr. Victor Ekuta, feel free to bcph.org, look him up, and feel free to connect with Dr. Victor. And we will bring you future episodes for 40 Under 40 Public Health Council Awards, Cohort 2. Thank you so much, and signing off. Thanks, Victor.